So to get things moving and to sort of keep things going, I'd again like to say hello to everybody and thank you yet again for taking the time to join us. I'd like to begin by acknowledging that the land from which I'm speaking is the traditional territory of the Haudenosaunee, and more recently, it is the territory of the Mississaugas of the New Credit First Nation. And I'd like you to take this opportunity to reflect on the territory on which you are residing or working or playing at the moment, and the traditional residents and caretakers of that land. And we're very happy to have a chance to connect with you in order to discuss and to share perspectives about patient-client-centered care. And for those of you just coming in, as you can see my name on the bottom of the screen, but I'm Brian Feist, and I'm the manager of professional practice at the college, and I'm joined by Ms. Cecilia Lee, our senior communications officer, and by our three panelists, and we'll give them an opportunity to introduce themselves in due time. We do hope that you'll find this session to be not only informative, but also engaging. And we certainly are looking forward to any questions and also comments and feedback you might have. And we will actually have a post-event poll that we'll run. And we'd encourage you to take some time to respond to that poll before you finally sign off at the end of the session. So to start, we're just providing, like I said, a brief presentation about the patient-client-centered care guideline at the college. And after that, we'll turn it over to the panel. So if we can move on further through the presentation. Patient and client-centered care is among the competencies that are found in both the kinesiologist core competency profile and in the essential competencies of practice for kinesiologists in Ontario. The college identified that it's in the public interest to provide more specific guidance, including clarifying the definition of patient-client-centered care within the context of kinesiology here in Ontario. To do this, we took a look at what we call our regulatory toolkit. We set out to provide a resource and information in the public interest, but also using the least amount of regulatory force that's needed to address this challenge and to provide this information. One of the options that we considered was creating what's called a practice guideline. As many of you here in attendance know, practice guidelines support safe and ethical decision-making by helping kinesiologists understand their responsibilities. The practice guidelines, they expand on and they clarify the college's expectations. So they're not necessarily at the same place as a practice standard, but they can also be used as benchmarks against which a kinesiologist's knowledge, skill, and judgment can be assessed or evaluated. And these guidelines are available on our website for kinesiologists and also for their patients and clients to review. So the guideline development process started with research and consultation, and that included assembling a working group of registered kinesiologists who have relevant subject matter knowledge and expertise. We're extremely grateful for their time and their engagement through the process, and we'd like to thank everybody who participated for their efforts and their insights. The result of that initial research phase and that development work was a draft practice guideline. The draft guideline was then presented to the college's Quality Assurance Committee, who recommended it to council for their consideration. Because the college's role and main focus is serving the public interest and protecting the public, it's important that this process includes public feedback and participation. So to gather that feedback, council approved the draft practice guideline for circulation in a 60-day public consultation. And in that consultation, we heard from a wide range of individuals and some organizations, including registered kins themselves, professional associations who represent registered kinesiologists, patients and clients, the general public at large, and also certain other organizations and bodies that responded to our consultation. All of the feedback we received was carefully reviewed. We grouped it into themes, and we used those themes to make further refinements and adjustments to the draft practice guideline. We really appreciate all the feedback received. I think we can't state that enough, and we really look forward to receiving more thoughtful and high-quality feedback in future consultations. The draft practice guideline, which was revised based on what we received from the consultation process, was again presented to the Quality Assurance Committee, who again referred it to council. And in March of 2025, Council approved the practice guideline for patient client-centered care. And like all our other practice guidelines, you can find it on the college's website. So we'll take a moment to talk about the practice guideline itself and its content. In the introduction, the practice guideline includes the phrase, "nothing about me without me." And it's used and it serves as a very high-level summary of the goal of patient and client-centered approaches to care. The practice guideline also includes in the introduction an overview of 4 general ways that kinesiologists can demonstrate patient client-centered care. And those 4 methods are respect for patients and clients, ensuring patient-client involvement and direction in decision-making, advocacy with and for patient-client needs, and recognition of patient-client experience and knowledge. So for a little bit more detail, we also included some specific examples of patient client-centered care and practice within the introduction and elsewhere throughout the guideline. All of the examples we included are grounded in the relevant performance indicators from the college's essential competencies of practice for kinesiologists in Ontario. And we thought that it was important to make those connections and to use that essential competencies document to ground the practice guideline in expectations that already existed. So one thing we decided to include in the practice guideline was a legislation section. We did include a broad range of legislation because kinesiologists practice in a variety of contexts and settings, and we wanted the practice guideline to reflect the entirety of the practice of kinesiology in Ontario. The goal was to raise awareness, but it was not necessarily to provide a total or a complete or a full list of all relevant legislation. We did also want to, beyond just including a list, we wanted to include a little bit of information about the legislation and how it might apply and how it might help kinesiologists act in the best interests of their patients and clients and involve them in decision-making throughout treatment care and services. So we created an appendix to the practice guideline that includes a list of relevant legislation and how it protects patients and clients. Because legislative and regulatory requirements can be extremely complex, it can be very helpful and even important to seek independent legal advice in one's own practice. And this can help ensure that registered kinesiologists fully understand their professional obligations and identify ways to reduce risks of harm and improve the quality and effectiveness of the care that they provide. We also included a specific section about the college's practice standards and guidelines beyond this practice guideline. Instead of just listing the standards or linking to the college's website, or just general advice to follow the standards or adhere to the standards, the goal was to give the reader a little bit of information about how the standard promotes patient client-centered care without necessarily, again, providing an exhaustive level of detail. So to sum it up, the college's standards and guidelines can help kinesiologists provide ethical and safe treatment care and services that's in patient-client best interests. The practice standards outline expectations for kinesiologists that contribute to public protection, and they inform kinesiologists of their accountabilities, and they inform the public and patients and clients specifically of what to expect from kinesiologists. The practice guidelines ultimately and the standards help kinesiologists understand their responsibilities and how to make safe and ethical decisions in their practice. The guideline includes some further discussion that's informed by the competencies and performance indicators in the essential competencies and other existing college resources of some additional specific considerations that are relevant to patient and client-centered care. And we'll go over 3 of those in a little bit of brief detail here. So as we know, there are many dimensions of wellness. Dimensions of wellness include, among other things, physical, intellectual, emotional, social, spiritual, environmental, occupational, and lifestyle factors. We believe that patient client-centered care includes understanding how these dimensions of wellness affect health and well-being, because moreover, we know that health and well-being are not just absence of injury and disease, and there are many factors aside from one's medical status or one's diagnoses or one's conditions that can impact how one feels. The key to this from a patient client-centered care perspective is that engagement with and listening to the patient or the client can help ensure that they're active participants and decision makers who are receiving the treatment, care, and services that are aligned with their needs, their goals, their values, their abilities, and any barriers that they might be facing to receiving care or to participating in treatment. And another specific topic that the practice guideline covers is equity, diversity, and inclusion. And this section highlights the importance of treatment without discrimination. It encourages kinesiologists to reflect on their understanding and awareness of equity, diversity, and inclusion principles. And there is some specific focus on patient client-centered communication and the importance of avoiding assumptions, misunderstandings, and addressing unconscious biases that might exist. There is a little bit of advice contained in the practice guideline, and that includes the advice that registered kinesiologists should reflect on their personal understanding of equity, diversity, inclusion principles. They should adopt and maintain culturally sensitive approaches in their practice. And the practice guideline also includes a glossary to help make some new or unfamiliar or higher level concepts a little bit more relatable. And we filed another section that was included was a bit of work focused on the virtual treatment care and services that could be provided and are provided by kinesiologists. Because this has become so common, the practice guideline was really an opportunity to more clearly describe virtual kinesiology services or remote kinesiology services through that patient client-centered lens. So applying a patient client-centered lens to virtual kinesiology practice includes, but isn't necessarily limited to by itself, assessing the appropriateness, safety, and effectiveness of virtual practice for each patient and client. There should be steps taken to ensure you can clearly identify the patient or client and making sure that you're receiving and seeking ongoing informed consent throughout the process. It's also important to have clear and transparent fee, billing, and invoice practices, and that can include stating really clearly when the services were provided virtually versus when they were provided in person. And it's also very important to think about protection of personal information and personal health information, particularly where there are many specific risks associated with that information being transmitted electronically. So, like so many other things, providing safe and ethical patient client-centered care is not a single goal or destination, if you will. Instead, it's more of an ongoing process of reflection, of learning, and commitment to the best interests of those we serve. And to help us continue on that journey together, I'd now like to invite our panelists to join us and share their unique and informed perspectives. Thanks very much. And that does bring us to the panel discussion. So I want to give our panelists a chance to introduce themselves to you all. I'm sure that they're looking forward to speaking with you as much as you're looking forward to hearing from them. I'll just ask them to identify in alphabetical order by last name. So Nicole, would you care to introduce yourself?
Sure. And thank you, Brian, and thanks for that great overview. I'm happy to be here today. So my name is Nicole Beamish. I'm an assistant professor at the School of Kinesiology and Health Studies at Queen's University in Kingston, Ontario. I'm also a registered physiotherapist, and I started my career in healthcare as a kinesiologist. So I've kind of had a little bit of evolution in my career, but I've been fortunate to be able to teach in both our physiotherapy program at Queen's and now with aspiring kinesiologists.
Thanks, Nicole. And I'd like to introduce our next, or I'd like to give our next panelist a chance to introduce herself. Ida, would you like to introduce yourself?
Hi, my name is Ida Pila, and I received some service from a registered kinesiologist, and I'd like to share my experience with the team later.
Thanks, Ida, and thanks for joining us. We really look forward to hearing perspectives from the patients themselves. It's a really important part of patient client-centered care. And finally, I'd like to give Erin a chance to say hello.
Hi, my name is Erin Savigny, and I am a registered kinesiologist, registered nurse, and I have a Master of Education from Queen's University as well. I currently work as a training specialist in the Center for Healthcare research and innovation at Conestoga College. Previously, I have a background as a registered nurse and kinesiologist in acute care settings, so hospital, in primary care settings, so doctor's offices, where I worked for 15 years in chronic disease management in terms of direct patient care, but also in management where I oversaw kinesiologists and nurses in their clinical practice. So I do have quite a vast experience, and I'm really happy to share it here.
Thanks, Aaron. Thank you again, Nicole, Ida, and Aaron again for joining us. And once again, I should thank all our attendees, and we really do look forward to hearing from you via the Q&A feature as well. So we're going to move to a series of questions that we have for our panelists. And the first questions, we will, because we know that our mandate, our role, our focus is protection of the public and protection of patients and clients. So I'd like to give Ida a chance to respond first, but we'll certainly give Nicole and Aaron a chance to chime in as well. So Ida, you talked about receiving care from a kinesiologist, getting treated by a kinesiologist. Can you describe what that care felt like and what made it feel like it was focused on you?
Sure. So I had an accident back in August of 2023, and because of this injury, I was put in a wheelchair for 7 months. Prior to this accident, I was an individual that did 4 to 5 kilometers of walking on a daily basis. So, being non-mobile at this point, I ended up gaining 30 pounds. I was a little concerned and I went to go see my doctor and for some recommendations. She advised me about this program that the Somerville Health Center provided, and it was called a Change Program. And this Change Program is a 1 year program where we met on a Zoom link meeting for 2 hours for a whole year. So the first 3 months it was on a weekly basis. The next 3 months it was on a bi-weekly basis. And on the final 6 months it was monthly, once monthly. And the second part of the session was led by an Arkin, and he always made sure that the last 30 minutes of his session had an exercise program for us to follow. Now, he was aware of my situation that I couldn't do the exercises in a standing position like all other participants, but he was very mindful not to point me out. So, what he would do before we started with the exercise routine, he ensured that he showed both the exercises in a standing position and also in a seated position so that he would tell the team, use whichever form is most suitable for you. He himself also went one step further because while he was leading us in exercises, he didn't do all of them in a standing position. He ensured that some of the exercises he performed at a seating position to make everyone understand that both formats were successful.
The wonders of technology. We certainly appreciate your sharing your story with us. And I think it might be a really good time to ask our other panelists, is there anything really there that resonates with you or anything that that comes to mind, having heard Ida's situation and the care she received? Just remember to unmute.
Yeah, I think it's wonderful to hear. And again, I've worked with kinesiologists as coworkers, and just to hear that you were supported and it was really normalized. And so normalizing that everybody has different limitations, different abilities, different bodies, and everybody needs something a bit more tailored. And that's why the profession of kinesiology exists, is because we are trained in the human body. And we really do appreciate and understand what people do need on a different level, and to be able to very seamlessly exhibit what it looks like to support everybody's needs differently, I think is absolutely wonderful to hear.
Yeah, and I don't thank you for sharing a little bit of your care that was provided to you. I think when you were chatting, you mentioned it, and I wonder if you would be okay to speak a little bit more when you were working with your kin. So, did you have a conversation? You had a conversation with the kin before you joined the group classes, or was it that? That's where I'm kind of curious
Okay.
about how what that conversation looked like, so that you felt like you could join those group classes. Because telehealth is tricky, right? To build a client relationship over a screen, as we're all on screens right now, it's different than in person.
Right. So it was a two-part. So we did meet with the Arkin on a quarterly basis. So before we went into the group setting, I had one session with him in his office. So, and that's where he was aware of everything and was very mindful not to point me out.
And did you find that that kind of built that relationship from the start for you?
Yes. Yes.
That's awesome.
Yeah. And I felt comfortable because I wasn't pointed out. Like I wasn't in a wheelchair when we were, but I couldn't because I had the injury in my ankle. I couldn't stand and put the weight on the ankle.
Great. And we actually have a follow-up question. I think it matches pretty nicely with what Nicole mentioned and what Aaron pointed out. So Ida, can you tell us what did your practitioner, your kinesiologist do, or what did they not do that really contributed to your experience, something that made it feel safe for you? How did they make you feel safe?
Okay, so just as I was mentioning, we met also on a one-on-one basis quarterly, so every 3 months, and we talked about an exercise plan that I can follow on a weekly basis at home. And what I really liked about these meetings with him is that he didn't just sit there and just give me an exercise plan and say, I want you to follow this plan and do this. We collaborated together. We discussed my needs, what I could do, what I couldn't do, and we came up with a plan. And then I would take that exercise plan home, work on it for the next 3 months. And then when we met again in his office, we would discuss what went well, what didn't go well, what would I like to improve. And we always wanted to increase the intensity of the exercises and the frequency. And I really liked that he was knowledgeable. And if I had any questions, we would sit down and discuss it and review. And he really made me feel comfortable, which made me really enjoy it and really want to do the exercises and get better.
Thanks, Ida. So something that really came to my mind, if it's okay, is it
Yeah.
really sounds like there was an ongoing conversation about getting your involvement, your participation, and yeah, your consent throughout the whole process. And I think that's really important for someone to remember when they're providing treatment is to think about, you know, you should be a participant, should be directing and driving the care. And I wonder, just to check in, do our other panelists agree with that? Do you have anything else, any other color comments you want to add before we move on?
I'll go. Uh, Something that I found was extremely helpful, and I can see it playing out here, is something called motivational interviewing. And it really is the concept of just asking questions of your patients or clients until you really get a sense of kind of what's important to them and then help them motivate them in a way so that you're motivating them to the end goal that they want and to the process and the goals that they want to achieve so that you're that framework that they can use to get where they need to go. And it sounds like that kinesiologist that you worked with really did that well because you were engaged and motivated and felt heard and seen and understood in terms of what your specific goals and needs were. And they were able to help you get there because understanding that taking exercise home and doing your what you're supposed to do for 3 months on your own, that's quite a feat. So good job on that. And I think your kin is also to thank there.
Yes, it was very helpful.
Yeah.
Thank you.
Okay, so we do have a question now for Nicole. And again, thank you, Ida. So our first question, Nicole, focused for you as an educator is, as people's healthcare needs evolve over time, how can registered kinesiologists continue to learn and apply best practices in patient client-centered care? If you have any thoughts. And other panelists, Ida and Aaron, also, if you have anything once Nicole's done, please feel welcome to chime in.
Yeah, awesome. Well, and so this is a big question, and I think, I mean, my simplest answer to this is the answer is always with the client or the patient. And so Ida so nicely set us up to really talk about this idea of communication, and it's a skill that you, regardless of how many assessment tools you have in your or treatment tools you have in your toolkit, it always comes down to that skill of communication. And so I think I'll give you a little bit of an idea of the course that I teach with our kinesiology students, and then kind of maybe build into that. And Aaron and Ida, feel free to jump in and cut me off anytime. So one of the classes that I get to teach is one of our last core courses. So it's called KMP 400 Professional Issues in Allied Health. And our kinesiologists, our students, not all of them are going to become kinesiologists, but a lot of them do go on to healthcare, to research, to medicine. And so it's interesting because I teach this course and I really frame it within the standards and guidelines of a registered kinesiologist. And what do they need? We're starting to introduce this idea of core competencies and what do they need as they're going out into their practices. But for the students that aren't thinking healthcare or aren't thinking they're going to become registered kinesiologists, I try to really highlight the importance of you probably already have been a patient, or you're going to be a patient later in life, or you're going to be that support person going to see maybe a kinesiologist or other healthcare professional. And it's really important for our students and our clients to know the standards that they should expect from their provider. And so within this course, I try not to teach patient-centered or client-centered care as like a single concept, or this is our lecture on patient-centered care. I really try to design this or to deliver this course so that students can really experience it, start to question it, and start to reflect on it. And I think that's, as healthcare providers, that's what we ultimately need to continue to do throughout our careers, as we try to recognize our own, like Brian mentioned, our own biases or our own methods that need to keep revising. And so one thing I start with my students is in the first couple weeks of class, I invite a patient to come in. And so here in Kingston, we have patient perspective partners, and they work with within our hospitals to provide that patient perspective. And so I have lovely volunteers that come in and work with our students, and they're really great at describing to our students what good care looks like. And it seems like that's what Ida had got to experience, which is awesome. But I also get them to explain some not so great care, or some instances in healthcare where maybe they could have received better care and why it didn't feel patient-centered, or I more often will say person-centered, right? How is that individual really at the center of their care, and kind of taking that person first mindset is really, really important. So now I'll try to jump back to your question, Ryan. But really, I think the biggest thing is recognizing that patient-centered care isn't something you learn once. It's not going to be something you learn in your fourth year of your kinesiology degree. As a practitioner, and I'm going to throw it out there, I bet you'll agree with me. It's something that we still fumble on, right? You're going to have great clinical interactions, and then you're going to have not so great ones. But that's where, as clinicians, if we can really start to build more intentional reflection into our practice, that can be super important. So really thinking about trying to learn from the interactions that you have throughout the day. And so maybe it's a part of your continuing education that you schedule that in, where you take a moment each week and really think about an interaction, and try to ask yourself, okay, did I really understand what that individual was asking of me or why they were coming in? Did I invite them to tell their story, or did I jump to my physical assessments, and did I make any assumptions along the way? And then also what like I think we're really great at setting SMART goals or helping our patients de decide what or help them kind of craft their goals, but who actually shaped those goals? Did the range of motion in that ankle and that being what my goal was that actually the client's goal or was that my goal? And so really kind of just having those moments to reflect on your own practice, but then also working with your peers or your colleagues to say, hey, can we talk about this interaction, or having them sit in on a session every so often, and just trying to create those mentorship moments can also be really great. But then when it really comes down to it, I, the client, if you can facilitate and guide a really well done subjective interview, your objective is going to be minimal, because your patient's going to tell you what's going on. And so having that partnership or trying to create that therapeutic alliance from the start, which starts when we go back to the reach, the coda ethics, with the college, it starts with respect. So if we can have that respect, we can start to build that therapeutic alliance. It's going to be really easy for me to say, Ida, I don't think our last session went really well. This is what I felt. Did you find that I wasn't listening to you? And just being really, really honest, and recognizing when maybe you didn't have the best day, and then looping that client back in and making sure that they're on board, or just checking in and saying like, this is the goal that I thought we were looking for, but is that realistic, or did I miss something? So not hesitating to make sure that that client's at the center, right? That's what it is when we're coming down to it. It's person-centered care. And then I think the other piece that I think we can all do as practitioners, again, is I said I'm a physiotherapist, but our standards, we have overlapping scopes of practice, and our standards and our guidelines are similar. But if you go back to those standards that the college has presented to us, and you read the standards with a client-centered lens, you really start to see this idea like consent and communication and professional boundaries. They're not just requirements, they actually are what's there to start to build and continue to build that therapeutic alliance with your clients. So if you can go back, because I know I will, well, we are recording, but standards can be really dry, and they can be, but if you start to read it from the patient's lens and like, how am I going to use this to build collaboration, to build trust, and to have that ongoing conversation with consent, you're not just going through the motions, you're really kind of building that relationship. And then always being open to learning from others. Like I said, like, Aaron, jump in and tell me if you disagree. But I think your peers and your colleagues within your clinics as well can really help with you to kind of have those conversations with each other.
Yeah, I agree. I think it's very important to open and be trustworthy right from the beginning. Because if you're trustworthy and you're open, it helps build that strong relationship. And I believe the treatment will go better.
Yeah, Nicole, Ida, absolutely agree. And Nicole, some fantastic points there. Absolutely. I was just thinking as you were talking, yes, yes, yes. It makes me reflect back when I first started working as a kin, and uh, in chronic disease management, you really think you're coming in with a lot of passion. As kins, we work with people, and we really do care about the people that we work with. And I remember sitting back and trying so, so hard to convince people to make changes that I thought would be the most impactful for them and their lives. And I remember, appointments were so long, and by the time I felt exhausted. And looking back, and something that I did develop, I realized over time was that might have been important to me. And when somebody's coming into the office, I may look at their chart in advance and go, "Oh boy, do we ever need to deal with this today?" But when they come down, they are just, a human being. They sit down, and I would just look at them and I say, I have a few things I think maybe we could address today, but really, how are you doing? What's important to you? What are you hoping to get out of this appointment? Um, Most of the time, they didn't say, I don't know, whatever you want to. Most of the time, they had an idea, right? Um, One of the biggest and most important concepts I've learned while working with patients is really, we go to school for a number of years and we are the expert in the human body, but the patients are the expert or the clients are the expert in their body. And really, it's extremely dangerous for us to treat all bodies the same and everybody the same. And so together, it's really a symbiotic relationship where they come to us because they need a bit more information than they have. And we just need to understand what they're actually looking for and actually how we can actually help them get there. Um, Another piece that is really important in terms of this question is um, patients' and clients' education levels. And as they learn more and more, their education, you're going to be able to help build that knowledge base of their body and what they actually need. Um, Coming from a Master of Education as well, I really, really understood the importance of understanding people's learning styles. So if somebody's not an auditory learner and you're sitting there and just talking and talking and talking and it's not sinking in, well, it's probably not going to end well. So understanding, how do they learn best? Is it something that you give them a pamphlet and you review it with them? Is it something that they need to really understand how it works? Then you take the time to understand how what's happened and what you're asking them to do and what they want to do all kind of come together so that they can actually understand and move forward that way. So really getting a sense of really what they understand to begin with, how they best learn and what they really want to learn and their goals and understanding those pieces together will really be a very good way to continue on with patient and client-centered care, especially as things evolve.
Thanks to all of you. Those are fantastic. So I think we've actually covered this. We did have sort of a follow-up question that we built in. Uh, I think we talked about how KINS can support ongoing learning, but I do want to give you all a chance because I know that many of our viewers are going to be really interested on, well, how can I learn this stuff? So maybe if any of you want to share. And one question I might have, Ida, from your perspective too, if you want to, how do you know if your kinesiologist is always reflecting on their practice and is always learning? So I'll throw it to you, and if everybody goes past, then we can move on. But I just want to give you a chance.
So I knew he was learning because of different things we talked about, and I was seeing a physiotherapist as well. So I talked about some of the exercises I was doing with my physio, and he knew exactly what I was thinking and where I was going. So that really impressed me.
Thanks, Ida.
That's okay. And I think really like I mean continuing to learn from your clients or even just going into different interactions. So like something I know as a new grad, I would go in now reflecting back, I would go into my assessments and I would just be so like laser focused on figuring out what that diagnosis was or figuring out doing my special tests, and I really didn't sit back and let the client tell their story. And I think that's as an entry when you're entering into a new profession, you're like, oh, I only have, like Erin said, this amount of time to do all of these things. And so I think one of the biggest switches, and I think thinking about how you introduce yourself to your clients and how you start that communication can be really interesting. So thinking back, thinking on moving forward, like even tomorrow when you enter your clinical practice, how are you starting? How are you introducing who you are? And then how do you really create a nice open-ended question to start? So you're not saying, so you have pain in your knee. How is that feeling today? If you can start an interaction with something like along the lines of, what do you think is something that is super important for me to understand about you, or your current situation, and just leaving it there. Like, don't worry about what you saw from the referral, and just starting that open-ended question and see where it takes you. And I think that is something that we can always kind of, as we're thinking about ongoing learning, it's like, okay, how many open-ended questions did I actually use today? And then can I change that, or could I shift that conversation? And so, yeah, it comes to this reflective practice that I think a lot of practitioners do, but just being very intentional with it.
I think also having the ability to say, I don't know when you don't actually know, and going away, researching it, coming back, um, and then sharing what you've learned. I heard a really good, I was at a conference a number of years ago, and they really highlighted the fact that with increasing um, AI use and increasing abilities for people to go online and find information that they need. There's apps, there's gadgets. People can wear a watch and, monitor their heart. There's oxygen monitors. There's all sorts of tools that people can now use to help manage their care. And we are one of those pieces. And it's really important to um, really encourage people to use what they have at their disposal to advocate for them to be able to understand and be a really great partner in their care with themselves. And so understanding that that might look a little bit different now than it did 10 years ago, 20 years ago, when somebody comes in and they have information that they do want to share with you, right? And so still being in that space where you are looking to support them and having them lead, but making sure that you're providing the education to them to understand that this is a reliable resource. This may not be, or this is how you use this tool or app. But this is the underlying reason that we want you to, or we may have some concerns there. And together really finding the way, because if somebody is going to do something, they're going to do it. And so we really want to support them and have them leave with as much knowledge as possible, um, so that they can be really safe in what they're going to do.
That's wonderful. Thanks to all of you so far. We're going to move on to sort of the next section, which will be the kinesiologist perspective. So, Aaron, you get to go first. And I guess our sort of simple question, we've already really talked about this, but what steps do you take in your practice when you're in clinical practice, and even as a leader or a supervisor, what steps did you take to make sure that clinical practice reflects patient-client-centered care? If there's anything we haven't already covered.
Yeah, I think really it's really important to understand um, the principles and your clinical work and your scope and all of that. And there is a lot of overlap um, with different professions. And I know as a nurse and a kinesiologist, to be honest with you, have a bit of trouble aside from like medication and some really hard skills. There's a lot of overlap there. And so you really want to make sure that you can work as high up in your scope as possible and competently, um, and making sure that you're reflecting on your work. And, as a manager, I was in charge of medical directives for kinesiologists and really understanding who kinesiologists can take orders from, for what situations, right? So we really want to make sure that um, you understand what you're able to do, what you're allowed to do, and really advocating when you feel like within your scope of practice, you're able to do more. I think that's really how we build the strength of the kinesiologists and really normalize the role of the kinesiologist within different sectors, is really powerful. I know we did cover a few of my points
Yeah.
already.
So
Were we gonna get to the question about the non-clinical
yeah,
roles?
that was the
Okay.
next place we were going to go actually,
Okay.
We've heard a lot about clinical practice. We've heard about from Ida what clinical practice feels like when it goes really well. We've heard a little bit about what it feels like when it's challenging. We've heard from you and from Nicole and from Ida about, from a learning, continuous learning and the importance of self-reflective practice. But we also know that a lot of our kinesiologists who are on this call may not practice in clinical roles. So I guess we'd want to ask you, Erin, and of course, Ida and Nicole as well, for those kins who don't provide direct care, how can they meaningfully incorporate the principles of patient client-centered care in their day-to-day work in those non-clinical settings? And the reason that we're asking is we think it's really a public interest piece. We think that patient client-centered care goes beyond clinical practice and it can extend to all kinds of fields and avenues of care. So
Yeah, so from my perspective, I worked for quite a few years as direct patient care, and then I moved into more management and clinical support, and now I'm in research. And so all the different roles had I learned so much from them. But what I've really learned is, if you're working as a registered kinesiologist, somewhere along the line, there's probably an end user who's going to be a patient or a client. So you may not be the one that is directly having those face-to-face conversations, but you are building systems or you're doing research or you're building policies and procedures, working on medical directives, all these different things. You're setting up steps within the system that you're working in that are going to benefit patients. And so it's really important to understand that these principles are not necessarily the end user that we're thinking of. We're really thinking that these are the principles that, as a registered kinesiologist, we apply in all of the dealings of our professional practice, that we are, it's in the word professional, in our roles, in our scopes, in our interactions with um, our coworkers, our management. We use them to advocate at all different levels, right? The micro, meso, macro level. We really want kinesiologists in positions where we're having a lot of feedback and say how systems, again, like the healthcare system or other systems that you may work in, that can be improved and actually incorporate the use of kinesiologists. And one that I've been really trying to push for a number of years is the roles of kinesiologists in primary care, right? Working in chronic disease management, working kind of expanding what typically within Ontario we would think a kinesiologist does. And I know that they are more and more these days working with patients in primary care or community care settings, but that's something we really want to advocate and continue to work with because we know exercise is, beyond anything else we could possibly do for our health. So that I think is really important. Another thing that I would say is what really stood out to me is nothing about me without me. And considering equity, diversity, and inclusion, right? EDI, we really try to take an approach using those fundamental principles in absolutely everything we do. Culturally specific approaches, right? So understanding how language may be interpreted. Also, translators, are we providing a service, but we live in Canada and we really want to make sure we're understanding how somebody may need a translation service to be able to access our care. So thinking about those pieces is really important, as well as just the direct patient care. So if you're not in one of those roles, then it's still really quite important to follow these principles and really demonstrate what it means to be a professional in the role of the kinesiologist. And just an example of how you include patients and clients. I recently was involved in developing education modules. It's been over close to a year that we've been working on this project, and we had an advisory committee and we had over 30 different meetings over the course of 7 months to really just get feedback and hear from them what they needed, and really helped us guide what we were going to develop for them, because it's just something where you need to kind of take your ego aside and really just say, I don't know more than the person that's here telling me what they need. So really understanding and saying, you tell me, and then I will help you figure out and how to create something for you.
Great. Thanks a lot, Erin. Ida and Nicole, is there anything that spoke to that? Mindful that we may have a couple of questions from the listeners and from our attendees, so we may want to get to those, but your thoughts would be really welcome on non-clinical as well as clinical kinesiologists and how they can still kind of practice in a way that meets the college's standards.
I think Erin hit it very well in what she responded.
Thanks, Ida. Nicole, any thoughts?
Yeah, I mean, when you think about like if regardless of where you're working, if it's in research, if it's in kind of project management or industry, the principles of person-centered care and this idea of building a relationship on trust and respect that crosses I'm going to say that crosses all professions, right? And so thinking about it in that, taking that mindset to whatever project you're going into, you're going to be able to co-create or co-develop something that's going to be way more worthwhile than if you just went on it on your own. So I think there's a lot to it. You're still working within the scope of practice and you're still adhering to those standards, and that's super important.
Great, thanks. So if we can move on, and maybe we can close down the slides briefly because we do want to come to our Q&A section. Oh, we have a Q&A slide. We do have one question that actually just came in. So panelists, I just want to ask you this from one of our attendees. How should registered kins approach circumstances where there may be perhaps either disparity or distinctions between the primary goal of a payer, like a third-party payer, and the primary goals maybe of the patient client? And how do they balance all of those competing responsibilities, or how could they do so, again, in a way that's in alignment with the college's standards and in a way that really focuses on the public interest all the time? If any, you may have encountered that situation, if any of you wanted to weigh in or give your thoughts.
Yeah, it's a tricky question, right? But at the heart of it, you have to think about so is it to be person-centered care, we're thinking about our ethics, right? So our client needs to have autonomy over their decision making, regardless of what the payer is saying. So there may be a confounds that you have to work within, but we have to think about making sure that we're balancing autonomy with beneficence, right? To do good. That's our goal, and that's our job as a clinician is to make sure we can advocate for that client as well. So there's that conversation being that open conversation, and I know like if it's MBA or a WSIB, that does make it could result in trickier conversations. But you adhering to person-centered care means that you're thinking about their goals. Are they realistic for them? And what can you provide, and how can you help that individual take ownership on their health and wellness? So I don't know how either Aaron wants to jump in there, but I think it's really making sure that you have those core ethical components at the heart when you're working within those constraints sometimes, right?
I agree,
I oh,
Nicole.
Ida, go
Sorry.
ahead.
I agree because sometimes the third party may not really understand what's going on with the patient. So I think it's very important that we have to listen to the patient and really understand what's going on with their bodies.
Yeah, I agree, absolutely. And it's really understanding where you have control. So the idea of a sphere of control and a sphere of influence, and you may not control third parties' decisions, but you may have influence over the situation. And absolutely, I love what Nicole said. And one big piece that I would encourage is really if you have influence over something, to really advocate on behalf of that patient and teach them how to advocate for themselves for what they need.
Thanks a lot. So I'm just going to wait and give anybody else a chance. Or Cecilia, maybe we've got any other questions for the panel. Well, mindful, you know,
we do have a few, but I'm being mindful about the time. The questions that we received from second. We have a few questions received from previous survey.
Okay.
I can share my screen 1 second.
So why don't we, panelists, how would you feel about maybe we just get to one of those for now, just because we don't want to take too much of everybody's time. And we do have a bit of a survey that we want to ask everyone to fill out too, to get some feedback. So Cecilia, maybe just bring up one of those questions just to give a chance to make sure we have good discussion.
Oh, of course. So I can just share one. Give me 1 second. Can everyone see it?
Yes.
So this is a bit of an interesting question. From one of the kins, a lot of our kins only do assessments. And how do kins apply patient-client-centered care when they are not entering into a therapeutic relationship with the patient-client?
I want to say, as soon as you say hi, you've started that therapeutic relationship. So maybe you're not seeing them into that treatment, but if we're even jumping on kind of that last question, you are going to be advocating. My assumption is you're going to be advocating from those assessment results for that client. And so as soon as you've introduced yourself and say hello, that therapeutic alliance has started, hopefully in a really respectful and trustworthy way.
Thanks. And I think I saw Aaron unmuting right around the same time as Nicole did. So I'll give you a chance if you had anything else.
No, absolutely the same. You know, when as soon as you're entering that relationship and there's that sharing of information, you are in that relationship. And I really do want to say that it doesn't matter how short that assessment is. It really does matter how you go about that relationship and small little assessments. People will leave if you do it well. They'll leave that situation feeling good or better than they were going into that relationship. So bring as much as you can into every interaction you have with patients, regardless how long it is.
That's great. So I'm going to actually give the last word to our patient because, again, we're here to protect the public and serve the public. And it is so wonderful that we have their insights here right with us this evening. So Ida, if you'd like, here's a chance to kind of tie it up with a bow. No pressure, sorry.
No, I agree. Like, I think it's very important to think of the patient and get their feedback and really listen to them because it's their body you're going to be helping them with. And keep up
That's
the great work.
That's wonderful. Thanks very much. Thank you so much to Nicole Beamish, to Ida Pilia. I'm sorry if apologies if I mispronounced slightly, and to Aaron Sevigny for all of your insight and your wisdom and your time that you've shared with us this evening.